Hello everyone, welcome to my channel, My Guide Pedia. Here is an essay on coronavirus, its symptoms and prevention in English for students. Coronavirus disease is a contagious disease. It is caused by a new strain of coronaviruses, SARS-CoV-2. Severe acute respiratory syndrome coronavirus 2. Coronavirus is a type of virus. The viruses under the microscope look like they are covered with pointed structures that surround them like a corona or crown. Pandemic disease. The World Health Organization in March 2020 declared coronavirus disease a pandemic as it crossed over multiple countries or continents. It originated from Wuhan city in China. The outbreak quickly spread around the world. This disease has infected millions of people and is responsible for hundreds and thousands of deaths all over the world. Symptoms of coronavirus disease. According to the World Health Organization, coronavirus is a family of viruses. It can cause illness ranging from common cold to more severe disease such as severe acute respiratory syndrome and the Middle East respiratory syndrome. COVID-19 symptoms are ranging from mild to severe. It includes common cold, cough, fever or chills, shortness of breath or difficulty in breathing, body ache, sore throat, loss of taste or smell, diarrhea, headache, fatigue, nausea or vomiting, and congestion or runny nose. COVID-19 can lead to pneumonia, severe respiratory problems, septic shocks, multi-organ failure, or even death. Some group of people are more at risk of having severe illness. For example, old-aged people and those with high blood pressure, heart and lung problems, diabetes, weakened immune system, and cancer. The mortality rate also varies between the countries. After exposure to the virus, people may start showing symptoms within 2 to 14 days. This time after exposure and before having symptom is called incubation period. The COVID-19 spreads through droplets of saliva released into air when an infected person coughs, sneezes, or talks. When a person touches someone with infection or a surface that has the virus and then touches their own nose, eyes, or mouth, he catches the infection. Prevention of coronavirus disease. Physical distancing is most effective in preventing the spread. It includes maintaining 6 feet or 2-meter distance from others. Prevention of this disease includes frequent hand wash, using face mask, not touching your face, quarantine for those who have symptoms. People with symptoms should stay at home and should avoid coming into close contact with other people to prevent transmission. Covering the mouth and nose with a tissue or handkerchief while coughing or sneezing is also helpful to prevent transmission. It is important to properly dispose of the used masks and tissues. Maintaining proper hygiene around the home and workplace is also important. The standard method of diagnosis is by real-time reverse transcription polymerase chain reaction. Vaccine for coronavirus disease. After about 1 year of trials and research, the COVID-19 vaccine has been developed, which provides acquired immunity against severe acute respiratory syndrome coronavirus 2. Several COVID-19 vaccines showing efficacy as high as 95% in preventing symptomatic COVID-19 infections. The trials had been done in 3 phases. The first and historical mass vaccination program started in early December 2020. Many countries planned distribution of vaccine that gives preference to those at high risk of exposure and transmission, like health workers, frontline workers, and the elderly. In India, 16th January 2021 was the day when inoculation of the vaccine was started. Conclusion. Rightly said, prevention is better than cure. The most we can do to prevent ourselves from this infection is to maintain social distance, wash or sanitize our hands regularly, cover our nose and mouths with a mask or cloth, and keep our surroundings healthy, clean, and hygienic. Thank you. If you like this information, then do like, share, comment, and subscribe to our channel.